When it comes to your health, it's always smart to be informed. So let's talk about cramps. When should you call 911 for cramps? Are there any warning signs that could indicate something more serious? Is there anything else you need to know? Keep watching to find out. But sometimes they can be a sign of something more serious. It can be mild or severe and usually only last a few seconds or minutes. However, some cramps may persist for longer. Muscle cramps typically feel like a tight pulling sensation in the affected muscle. They can also cause muscle twitching or spasms. If you get a cramp and it is severe or doesn't go away, you may want to seek medical attention. Pregnancy can cause muscle cramps because of the added stress on the body from the growing uterus. Medications that increase fluid loss, such as diuretics, can lead to dehydration and electrolyte imbalance, which can cause cramps. So it's important to stay hydrated and eat foods that are rich in electrolytes such as bananas, potatoes, and spinach. You can also try drinking a sports drink to replenish electrolytes lost through sweating. This is because they could be a sign of a rare but serious condition called malignant hyperthermia. Malignant hyperthermia is a rare, genetic disorder that can cause a sustained muscle contraction, leading to a high fever and other complications. Symptoms of malignant hyperthermia include muscle rigidity, high fever, rapid breathing, and altered mental status. However, it's important to note that if you have kidney disease or another medical condition that affects fluid balance, you should speak with your healthcare provider before consuming large amounts of fluids or electrolytes. Deep vein thrombosis is a potentially life-threatening condition that occurs when a blood clot forms in a deep vein, typically in the legs. It's essential to seek immediate medical attention if you suspect you may have developed DVT. By staying informed and proactive about your health, you can ensure you receive the appropriate care when it's needed. Early diagnosis and treatment are crucial to prevent potentially life-threatening complications such as pulmonary embolism, which occurs when a blood clot travels to the lungs. If you suspect you may have a medical condition, please consult with a healthcare professional for proper diagnosis and treatment. And if you find this video helpful, please like and subscribe. It helps others find this video and encourages us to create more health-related videos. Thanks for watching. Stay healthy. Treatment for DVT typically involves anticoagulant medications to prevent further clot formation and reduce the risk of complications. When a blood clot develops in a vein, it can obstruct blood flow, causing blood to pool in the veins below the clot. This can result in swelling, pain, and discoloration of the affected leg or arm. One of the key signs of DVT is the presence of a blood clot in the deep veins, usually in the lower legs. This clot can be difficult to detect, but certain tests such as ultrasound can help confirm the diagnosis. While most leg cramps are harmless and resolve on their own, there are some instances where it's essential to seek urgent medical attention. It's crucial to be aware of these rare but potentially serious conditions to ensure you receive timely medical intervention if needed. Certain medical conditions, such as kidney disease and liver disease, can also cause muscle cramps by affecting the body's ability to regulate electrolytes and fluids. Peripheral artery disease occurs when there is a blockage or narrowing of the arteries that supply blood to the limbs, most commonly the legs. This blockage restricts blood flow, which can cause symptoms like cramping, pain, numbness, or coldness in the lower legs or feet, particularly when walking or exercising. The cramping pain, also known as claudication, is a hallmark symptom of peripheral artery disease. It typically occurs in the calf muscles, but can affect other leg muscles. The pain is often described as a tightness or aching sensation that occurs during activity and subsides with rest. Claudication is triggered by walking or exercising due to reduced blood flow to the leg muscles. As the muscles work harder, they demand more oxygen and nutrients, which the narrowed arteries are unable to supply effectively. This results in cramping and other symptoms. But most muscle cramps are not serious and can be treated at home. Risk factors for peripheral artery disease include smoking, diabetes, high blood pressure, high cholesterol, and a history of heart disease or stroke. If left untreated, peripheral artery disease can lead to serious complications, such as poor circulation in the legs. It's increased risk of heart attack and stroke, and in severe cases, tissue death due to lack of blood flow. This condition is more common in individuals over the age of 50, and is more prevalent in people with underlying health conditions like diabetes. Most muscle cramps go away on their own within a few seconds or minutes. However, if a cramp lasts longer, you may need to do some light stretching to relieve it. A healthcare professional can help determine the underlying cause of the cramps and provide appropriate treatment. For example, if the cramps are caused by an electrolyte imbalance, a doctor may recommend intravenous fluids to help restore balance. If the cramps are caused by a medical condition, such as kidney disease, a doctor may prescribe medications to manage the condition and relieve symptoms. To do this, slowly and gently move the affected muscle into a position that feels comfortable. Hold the stretch for a few seconds and then relax the muscle. You can also try applying heat to the cramped muscle. This can help relax the muscle and improve blood flow. You can do this with a heating pad, warm bath, or hot towels. In addition, massaging the affected area can also help break up muscle knots and improve circulation. But first, if you find this video helpful, please like and subscribe. It helps others find this video and encourages us to create more health-related videos. Muscle cramps can happen to anyone at any time. They are often harmless and go away quickly. A muscle cramp is a painful, often involuntary contraction of one or more muscles. There are many different types of muscle cramps, including those caused by dehydration, electrolyte imbalance, overuse, pregnancy, certain medications and medical conditions. Dehydration and electrolyte imbalance are probably the two most common causes of muscle cramps. Lactic acid can build up in your muscles and lead to cramping. This is why it's important to take breaks and stretch your muscles when you're working out. Electrolytes such as sodium, potassium, and magnesium help regulate muscle function. When you sweat, you lose fluids and electrolytes, which can lead to cramps. This is why it's important to stay hydrated and eat foods that are rich in electrolytes when exercising or during hot weather. You can also consider taking electrolyte supplements, but it's always best to speak with your healthcare provider before taking any new supplements. Overuse or fatigue can also cause muscle cramps. This is because when you use your muscles for a long period of time, they start to produce lactic acid. Other causes of muscle cramps include pregnancy, certain medications, such as diuretics, and medical conditions, such as kidney disease and liver disease. Now that we know a bit more about what causes them, let's talk about how to relieve cramps. As I mentioned earlier, dehydration and electrolyte imbalance are common causes of muscle cramps. If a cramp persists for an extended period of time or doesn't respond to home treatment, it's important to seek medical attention. It's important to seek immediate medical attention if you experience sudden severe muscle cramps accompanied by other symptoms. So let's talk about when it comes to cramps, especially in the legs. Might be something more serious and require you to call 911. One of the serious conditions is peripheral artery disease, also known as peripheral vascular disease. The primary cause of peripheral artery disease is atherosclerosis, the same condition that can block coronary and cerebral arteries, except that it blocks the arteries in the limbs. Another condition you need to call 911 for is deep vein thrombosis. It's also known as DVT. Several factors can increase the risk of developing DVT, including prolonged immobility, such as sitting for long periods, surgery, pregnancy, certain medical conditions like heart disease and inherited clotting disorders. While muscle cramps in the legs can often be attributed to temporary issues like dehydration or overuse, it's essential to be vigilant and seek medical attention promptly if you notice any concerning symptoms. Remember, this video is for educational purposes only and does not constitute medical advice.